Hello and welcome to Let's Collaborate, a podcast from the Southwest Doctoral Training Partnership. I'm your host, Chris Garrington, and joining me for this episode, recorded at the Collaboration and Connectivity Conference, is Beth Taylor, who's researching children's 24-hour movement behaviours and how they impact their health. And Beth is based at the University of Bath, so welcome. And I wonder if you can just start by telling us a bit about your research.
Yeah.
What are you actually looking at?
Sure, yeah. My research is in sort of the realm of physical activity and health research. And it's looking at going past the traditional views of activities such as physical activity and sedentary behaviour, because in the past, in research, they've been sort of used as independent entities, but they're not, because if you're being active, you're not being sedentary, or if you're asleep, you're not running around. So it's sort of more looking at a 24-hour focus and how then this combination of sleep, sedentary behaviour and physical activity combine over the 24 hours to impact physical and mental well-being outcomes. So at the moment I'm looking specifically in kids, so a lot of my research is sort of kids from 6 to 18, but yeah, looking at how it also impacts them over sort of transition points. So some of my research at the moment is looking at comparing year 6 and year 7 students, so trying to get to that transition from primary to secondary school and really looking at this, like I say, the 24-hour focus, but also with context behind it. So a lot of the time with physical activity research, we found, oh great, physical activity, the more you do, the better health benefits, right? But there's not a lot of contextual information around that. So it's like, okay, well, what were they feeling when they were doing that physical activity? Who were they with? Were they actually enjoying it, or were they forced to do it? So that's sort of what we're trying to put to the 24-hour and this composition of movement behaviours.
I'm fascinated to know how you're going about this research. So what does it actually involve?
So I sort of because I come from a sports science background, I'm very heavily quantitative. So I did my MRes with SWDTP was my advanced quantitative methods, but that was mainly because of my complex, in inverted commas, analysis I'm doing for my PhD, which is compositional analysis, which basically just combines these behaviours into a nice analysis. So a lot of it is quite quantitative. I'm doing 2 sort of secondary data analyses on pre-existing data sets that sort of have all of the necessary elements like the physical activity, sleep, and sedentary behaviour research. And I'm looking at, in one paper, looking at that in terms of cardiometabolic health outcomes in children, and then health-related quality of life in another paper. But then my sort of hands-on primary data collection study, I'm looking at this like transition point that I mentioned. So yeah, how does the composition of physical activity, sedentary behaviour and sleep change when children move from primary to secondary school, but then also the context behind it. So I am doing some quantitative stuff for that, but I'm also doing qualitative like interviews, focus groups and like questionnaires to sort of understand why, how, why does it change, that sort of thing.
So I guess the big question is what new insights you think your PhD, or you hope your PhD will provide, and how those insights might help benefit people. I guess whether that's teachers or parents or people who are generally concerned with the well-being of children.
Yeah, so I think there's a few different things. So within physical activity research, there's physical activity guidelines. And so that sort of tells different groups of people at that age how much physical activity you should be getting, how you should limit sedentary behaviour, sleep, that sort of thing. And so those guidelines sort of in the past have been very individualised in the sense of just physical activity or just sedentary behaviour. So there is a focus on trying to move towards like the 24-hour focus. And so it's hoped, well, by me and some people I work with, that looking at this specific research will help develop guidelines within the 24-hour realm, especially when it comes to like interventions and stuff like that, applying some of those guidelines to interventions. From a personal standpoint as well, I would love to see sort of the 24-hour focus put into more of the physical activity apps and like watches and stuff like that, because I think at the moment You know, we can look, sure, it'll tell you how much you've done in a day, but then it won't sort of bring it all together and sort of show you, well, what you're doing in the day, how is this then benefiting you, or what could you do to help improve some of those benefits. So I'd love to see some of that work into that. But I think one thing to be really cautious of in that is like the guidelines are great, but there's a big conversation at the moment with some of us who are sort of saying, well, who are those guidelines for? Because if I talk to a lot of my friends and I say, oh, do you know what the physical activity guidelines for? They're like, I don't know what you're on about. And, you know, there are people who are sometimes active, sometimes not. And realistically, those guidelines should be for everyday public, not just for researchers. So I think with sort of outside of just the main focus of the shift to the 24-hour, I'm hoping that through my research I can try and explore how to get, you know, some of this research out there a little bit more, but also work with people to understand why they don't know those things, if that makes sense.
No, so some real applicability potentially to business as well as people's lives, but also this whole idea of, you know, wanting to communicate and disseminate and raise awareness as well, which all sound really, really, you know, great ambitions as part of your PhD. And on that note, I wonder from your experience to date whether you've got any advice that you would give to others looking to embark on these big pieces of work, right? It can be a long and hard path doing a PhD, but and you've got to be really sure that you want to do it right. But what would your advice be? Have you got a particular tip that you might like to share?
Well, maybe firstly, talk to a psychic before and don't start it at the start of a pandemic. That probably would have been a good idea. But I think I was actually having a conversation with a group of people that I have like a WhatsApp group with from different unis yesterday, because one of them's just started her PhD year, and she was basically detailing to us her imposter syndrome without labeling it that. And I think my advice to her then was, like, that is all valid feelings. Everyone, you know, feels like that, but it is everyone. You're not alone in those feelings. And I think it's really, really easy to, especially in a PhD, feel really isolated because of those feelings. And as hard as it can be, sometimes getting yourself a group of people or having some of those conversations early on with people, because it can get you like pretty bogged down in it and you just end up sort of questioning anything that you do. And so I guess like in that vein as well, just like get involved in things, like as kind of probably cliche as it would be, if you get involved in stuff, like I got involved with the SWDTP conference back in 2020, that turned into like chairing the conference, but also making some friends and actually having connections with it. And actually some of us have dragged each other through the PhD, and if it wasn't for them, you know, it would have been a lot more miserable time. And I think getting involved and being open about how you're feeling about it, because otherwise you'll get isolated pretty quickly.
That's fabulous. Thank you so much, Beth. Thanks for listening to this episode of Let's Collaborate from the Southwest Doctoral Training Partnership. Don't forget to subscribe wherever you listen to your podcast to access earlier and new episodes.